be nice.
Hi, my name is Christine Tessmer. I'm doing my assessment. So first I'm going to gather my supplies and provide privacy and do hand hygiene. We're going to observe the general appearance of the patient and look for any abnormalities, physical deformations, personal hygiene, and making sure that the patient is clean, and assess their clothing, whether that's appropriate for the season, which today it was very warm. Also for the mood, the effects, whether the patient is alert and oriented, their skin color, their posture. First we'll start by asking them what their name is. Can you tell me your name?
Rebecca.
This just checks, they are awake and to see if they're oriented. Do you remember when your birthday is?
In June.
In June. So now we will do the head assessment. We'll just observe and watch for eye contact, which we did that in the orientation. And so then you are going to palpate and make sure there are no bumps or lesions or deformities in the scalp. And with that, we're also going to check for any pressure in the sinus cavity. How's that feel? Any pain? So we'll do the frontal and the maxillary sinuses. And then we'll check. Look at me. We'll check the eyes and the eyebrows and look for symmetry. We'll check the TMJ joint to make sure can you open and close, to make sure that that's intact and there's no issues with that. So after we do that, we will look at the eyes. We want to check the color, make sure the sclera and the conjunctiva is pink and there's no jaundice and it's white. The pupils. So we also need to do the confrontational test, and this requires them to put your hand over this eye, and then whenever I put my finger up, you tell me when you see it.
I see it.
All right, and then we'll do the other side.
I see it. I see it. I see it.
All right, now we're gonna do the switch. All right. So tell
I
me.
see it.
See it?
I see it. I see it.
You see it? Now look down.
I see it.
Yeah. All right, and so that's to check the peripheral vision. We can also do the Snellen chart test, which we do not have, but you would stand 20 feet away, look at the chart, read the letters on it, and there is a number associated with that to let you know what their vision is from 20 feet. And then they also would cover the eye and read the numbers to determine the which eye is where they're at in vision on each set. Also, we can check for the red reflex And we also can use the ophthalmoscope, which we don't have, but you shine the light in and look at the pupils. Look, can you look back over there? And watch and see of how they're reacting to light. And then we also can bring the light in and look for direct and see that the left eye is reacting to the light. And then you also want to look at the right eye. That is consensual and the other one's direct. And then we'll do her right eye, look straight. And that one is constricting. And then her left eye was constricting. And then we can also check the muscles of the eye. So follow my finger by doing that. We go, and then go up, follow it up, follow it down. Don't move your head, just your eyes. And then up, down, and then watch as they move in. So that checks the muscles of the eye. So she does have the perla. The pupils are equal and reactive to light and accommodation. The pupil size, we looked at the irises of the eye, the sclera, and the conjunctiva. And there's no external structures on the eye that are abnormal, her eyelashes and all that. So now we're going to look at the ears. So we inspect the external part of the ear, looking for drainage, redness, any lesions, which both of hers are intact. And you can also pull to see if there's any tenderness. Does it have any pain on the earlobe before inspecting inside? So now we can take our otoscope, look in the ear canal, and check the external ear for redness, irritation, and then look at the tympanic membrane, which is gray in color and it is reflecting light. It is intact and there's no lesions or redness or drainage. Same with this side, we look and check for redness and look at the tympanic membrane, which is also intact and gray and reflecting the light. Also, with checking the external canal and the tympanic membrane, we also do the whisper test to check to see how they're hearing. And so by doing this, you would cover the inside of the ear and then say something. And so she did hear that, and then so we can come to the other side and do this side. So she did pass the whisper test. Next we do the nose. We're going to inspect for symmetry and any lesions, and then we also want to look in the nostrils to see if they are clear or if there's any irritation in the mucosa. And so we also want to look. So we can do that by tipping up and looking in, and you can see the turbinates to see whether they're irritated and the flow, whether there's airflow or if it's pink and moist in there. So now we're going to inspect the mouth. We're going to look for lesions, look at the gums and the teeth, the buccal mucosa. So open your mouth, and it's moist and pink. Her gums are also, and we look at her teeth, and they're all intact. There's no open sores. We want to look at the uvula to make sure that it is able to move. Can you say ah? Look at the tonsils and give them the grade, and they are at a 1. The uvula is able to move and it is intact. It is not red. We look at the soft palate, the hard palate up top, make sure there's no lesions or open sores. Say ah again. The floor of the mouth, which was also moist. And have them stick their tongue out to check for movement. Can you stick your tongue out for me? Alright. And so now we're gonna inspect the neck and the throat, which includes the trachea, looking for deviation, making sure it's symmetric, no deviations with that, and the thyroid, making sure there's no lumps or nodules on it, and also palpitating for the lymph nodes, which you can start with the lymph nodes, and you can do the occipital, which are in the back, and then you do the preocular, which are in front of the ear, and feeling for any nodules or anything, and then you do the posterior ocular, which is behind, and then you've got the tonsilary, which are back there, and then you've got the supramental here and the supramandibular, which are in the mid, and then you have the anterior cervical, and then you also have that you can palpate, and also the posterior cervical, and then you have the clavicle, supraclavicle lymph node, and then you look at push on the trachea, and then check the thyroid, which is just below the cricoid process. We also want to check the range of motion. Can you tip your head up and down and side to side, and looking for muscle strength or if there's any weakness on either side. And that concludes my examination.